Hello and welcome to our channel Medicalcodus Connect. We bring various topics related to medical coding. Today we are here with a video on Introduction to Medical Coding. Please subscribe to our channel Medicalcodus Connect. Also please join our WhatsApp group Healthcare Connect and Facebook group Medicalcodus Connect for latest job openings. Details of the groups will be in the description and comment. Let's dive deep in the topic without any delay. Let's understand what medical coding is, in a simple and friendly way. What is medical coding? Medical coding is the process of turning health-related information into standard codes. These codes represent the diseases, treatments, procedures, and even medical equipment used during a patient's visit. Imagine this: a doctor writes down in the chart that a patient has high blood pressure and was given medication. A medical coder reads that note and assigns the correct code for high blood pressure and for the medication given. These codes are used for billing, insurance claims, and keeping proper medical records. Types of medical codes: there are mainly three types of codes used. 1. ICD codes. These stand for International Classification of Diseases. They describe the diagnosis, what illness or condition the patient has. For example, the code E11.9 is for type 2 diabetes without complications. 2. CPT codes. These are current procedural terminology codes. They describe what the doctor did, like a checkup, a surgery, or an X-ray. For example, 99,213 is a code for a general doctor visit. 3. HCPCS codes. These codes are used for things like ambulance services, medical supplies, and injections. For example, J3420 is the code for a vitamin B12 injection. What does a medical coder do? A medical coder reads the doctor's notes or hospital records and figures out what services were given. Then, they assign the correct codes based on that information. This job requires 1. A good understanding of medical terms. 2. Knowing the rules and guidelines. 3. Paying close attention to detail. The goal is to make sure the coding is accurate, so that doctors get paid correctly and the patient's records are complete. Where do medical coders work? Medical coders can work in 1. Hospitals. 2. Clinics. 3. Insurance companies. 4. Billing agencies. 5. Even from home as remote coders. Some specialize in areas like inpatient coding, outpatient coding, surgery, or radiology. Do you need certification? Yes, getting certified helps you grow in this career. Popular certifications include 1. CPC, Certified Professional Coder. 2. CCS, Certified Coding Specialist. 3. COCE, Certified Outpatient Coder. CIC, Certified Inpatient Coder. These are provided by AHPC or AHIMA, which are well-known organizations in the medical coding field. How much can you earn? In India, freshers usually start between 15,000 to 25,000 rupees per month. With experience and certification, you can earn 50,000 rupees or more. In the US, salaries range from $40,000 to $80,000 per year or even higher. Final thoughts: medical coding is a growing career that combines healthcare knowledge, technology, and precision. It plays a very important role in the healthcare system, making sure everything is documented and billed correctly. If you enjoy working with details, love learning, and want to be a part of the healthcare world, medical coding can be a great choice for you. That's all for today. Please subscribe for latest informative content. Till then, goodbye.